Let's talk about supported decision making. What does it look like in practice? Here's one example. Meet Marvin. Marvin is 93, lives alone, has moderate dementia, and says he's never moving from his home. His house needs quite a few repairs, and he doesn't always have food in the pantry, and he won't let his kids inside to help him. Marvin has completed a healthcare directive and power of attorney appointing 3 of his kids, but they're nervous about taking action and don't even know if they can. They feel overwhelmed by how to help Marvin and are very worried about him. Another daughter was told by Marvin's doctor that she should pursue guardianship so she could have complete control of everything. All of Marvin's children think that his resistance to getting help is a symptom of his dementia and proof that he needs to be moved to assisted living. When a social worker helps explain and facilitate supported decision-making, they start to see how it works. This social worker visits Marvin several times, helping him organize mail and arrange grocery delivery while building a trusting relationship with him. After they've built trust, it comes out that Marvin's resistance to getting help is rooted in his sense of autonomy. He says he doesn't want to be locked away in an institution with people babysitting him all day. Once they understand Marvin's concerns, the social worker and Marvin's family can work together to get Marvin the help that he needs in his home rather than moving him to a care center. And because Marvin feels respected and heard, he's open to the recommendation of others. With these added supports, he's able to stay in his own home. When we're faced with hard choices like whether to move someone to a memory care center or help them remain at home, it can be hard to weigh the risks and benefits. In this case, Marvin and his family found that they could address risks while still honoring his choice to live at home as long as possible. Marvin and his family worked with a social worker, but some families don't. Supported decision-making will look different for each person. This is just one example of supported decision-making in action. For more information about supported decision-making, visit voamnwi.org.